The pandemic has had a significant impact on the mental health of our kids.
It really has. Tonight, the chief pediatric nurse over at Beaumont in Troy is sharing the suffering she is seeing with children coming into the emergency room. Our Sandra Ali takes a look at the problem.
It's a dramatic change in the past year or so since COVID-19. We're talking about the sheer volume of children and teens suffering from depression and other behavioral health challenges who end up in the ER.
Originally, when the pandemic started, we saw a decrease in all patients coming in, pediatric patients in general, for anything.
But since COVID, Sarah is seeing more children coming into the ER for mental health emergencies.
Things from depression to anxiety, suicide attempt, anger, aggression, all kinds of eating disorders now, mood disorders.
The numbers are both staggering and heartbreaking.
We are seeing down to age 8, 7, 6 sometimes coming in and verbalizing, thoughts that they want to harm themselves or that they're sad or things that we don't typically see in that age group.
With a real strain on child psychologists and therapists on top of that, desperate parents with nowhere else to turn are looking to ER doctors and nurses for help.
It really comes down to talking to them about that. Are they upset about something and they're just using those words because they've heard them? Or are they really upset to the point where, no, this child really needs to sit down and talk to a therapist or see a psychiatrist? And how much help do we need to get this family?
Across the country, the Centers for Disease Control and Prevention report mental health ER visits for teens 12 to 17 surged 31% in 2020.
It's not just simply looking at them like you normally would with like a cut or a broken bone or something like that. It's more about feeling out how the child is acting and figuring out really how deep does this go.
The pandemic has been especially hard on young girls. ER visits for teenage girls attempting suicide went up 51% this year as compared to 2019.
Some kids were struggling with the isolation piece of things, but other kids are now struggling going back to school. So it's both ends of the spectrum on that.
A crisis taking its toll on not only families, but also frontline workers in healthcare who aren't always trained in how to help.
You're helping the family, you're doing the best that you can do, but it's the after effects that I worry about. I worry about the nurses, the techs, the providers. What part of this are we going to deal with after this is over?
Sarah says part of the solution is to make changes to your child's daily schedule.
You got a routine. So you've got to eat well. You have to get enough sleep. You need to put your electronics down. You need to get yourself in bed. You need to clear your mind. You need to find a routine that you can do every day.
Plus know some of the signs to look for.
If they have a sudden change in their sleep pattern, if they're having sudden mood changes.
And according to the Michigan Department of Health and Human Services, inpatient psychiatric visits are surging now, too. The agency, in fact, tracked nearly 2,000 visits before the end of June. Back to you.
All right, thank you, Sandra. Schools are critical in our communities to supporting children and their families, including programs for physical, social, and mental health. But the pandemic disrupted those services for so many kids. The CDC says that increased the burden at home, potentially affecting the long-term outcomes for both parents and children.